Hi, my name is Cecily Peralta, and I have two kids. And this is my daughter Josendi, and she is 10 years old. She have a lot of medical conditions. She have a seizure disorder, and she have asthma. She use a G-tube for feedings. She is a very nice girl. She is very happy. She loves the school. She like the bus, and she like the music. And she can speak, and she can dress by herself, and I do everything for her. I know when Jessendi is very sick, and I recognize the seizures. I recognize when she needs the 911, and I need to call. When Jessendi is sick, when she have seizures, is most of the time when I call the 911 because she is very sick, and I know she needs the ambulance. For me, the service for the EMSA is very good. All the time when I call the 911, the people respond very fast, come to my house and try to help my daughter. In the past one time, when the MT staff come to my house, I remember the fire department is in my house too. The fire department guy go to Yesendi and the ambulance, putting like the AV to her. I don't understand why the firemen put the IV to Yesendi. Somebody explained to me, and I'm very scared because I don't understand what happened. In the past, the people come to my house, write all the information in one glove in the hands, and it's nothing like formal, like paper or something. So I think some information can lost, and it's white. I don't like it. Sometimes when the EMT staff come to my house, made me feeling like bad because they ask me a lot of questions about the medicine to her, and are you sure you give the medicine to your daughter and don't forget any dose, and are you sure, and it's many times, and I feeling so bad because I'm sure I give all of it to my daughter, and the people is like no believe me. And I want the EMT staff know, and I'm expert to my child, and I know everything about her, and I like to help when the emergency happen.
My name is Corey Sutton. I'm a master police officer with the University of Oklahoma Police Department in Norman, Oklahoma. I have twin children who are 11 years old, identical girls, and they're a handful. They have been diagnosed with seizure disorders, autoimmune encephalopathy. You can't get a real solid answer out of these two. They're very difficult to get answers out of, which is a challenge. So if you ask them, are you hurting anywhere, and they say yes, they may not be. Just the same as if you ask them if they're hurting where they say no, again, that may not be the case. Brooke, at the age of 8, and we were on our way to my wife's father's for Christmas dinner, and we had not even left our neighborhood. We were 1 block away from our house, and she threw up all over the back of the car. And when I turned to look at her, she was as gray as she looked dead, except for she was awake. I could tell she was awake, but her coloration, she looked dead. It was really scary. It's the first time we'd ever seen that. We called MSTAT, and MSTAT came pretty quickly. They were very good. I explained to them what we knew, which at the time we really didn't know about the seizures. We didn't know what the issues were. We had no idea because we hadn't seen this before. But we knew that she'd had developmental delays. Both of the paramedics were very good about getting us loaded up and getting her stabilized. And we rode all the way from Norman, Oklahoma to Children's Hospital in Oklahoma City. They asked us a lot of questions because Brooke was unresponsive. I mean, she was pretty much unconscious, so they had to ask us a lot of the questions, and they had no problem with any of the answers we gave them. They were very open with us. If I have an MSTAT individual who's responding on a complaint from Brooke especially, and she's saying that, you know, my back hurts, I'm going to say, well, just because she's lifting up her shirt and says my back hurts doesn't mean that's where the pain is. If I see the injury occur before MSTAT gets there and that's what they're coming for, yes, I will definitely say, okay, this is what I saw, this is what I believe she's complaining about. Basically, if you're going to respond on a child that's having issues or something like that, you need to ask whoever was with them, the caretaker, about any special needs or about any special circumstances, because hopefully those that are with them are going to know more than you know, obviously, when you get there. And they should hopefully be able to point you in the right directions as far as what you're there for, what the past history has been, what just happened that's causing this call out. I mean, definitely use the people that are with the children to get answers, because otherwise you could be going in the dark and you don't know without talking to the caretakers that are helping them. So.